Hello, I'm Jenny Wakefield. I teach health and social care, and I've been teaching at Bede Sixth Form for a very long time now, and I've taught health and social care for a really long time. Some of the key things you should know is that my students get excellent results because we work as a team. I work with you, you work with me, and we get the best that we can. One of my most favourite aspects of health and social care is learning about communication, and particularly non-verbal communication, because we all need to be able to read other people's communication. So I hope that in September you can join me in health and social care. And obviously, if you've got any questions, you can ask them today. So we're going to move now to a slideshow, which Liv will put on the screen for you now. Okay. In health and social care, there are 4 qualifications you can achieve over the 2 years you're with us, but the 2 most popular are these. So most of my students in year 12 will do a certificate, which is about half an A level, and you complete 3 units in that, and we start that in September in one class. And the second year of your course will be the extended certificate, which makes up a full A level for you, which you complete more units, which I'm going to go through at the moment. So you would take 1 class of health and social care, and you would take 2 other subjects over 2 years. So for example, you might take health and social care and applied science and psychology, or you might take health and social care with sociology and English literature, or health and social care and biology and chemistry, whichever you want to actually do. Okay. Some of my students follow this pattern, not so many students, but it's quite a useful one. You get the equivalent of 2 A levels over 2 years. So in year 12, you would do the extended certificate. Sorry, I've just seen a spelling mistake there. 1 full A level equivalent, so you complete 6 units in that year. Then in your year 13, you do the full diploma, which gives you 2 full A levels, and you can complete other units as well. So you would take 2 classes of health and social care and 1 other subject. For example, very popular, the subject to go with health and social care is applied science. Quite a few of my students also would do health and social care 2 classes, plus some psychology or sociology or criminology, all popular combinations, but you can combine it with any subject as long as it fits onto the timetable and you have the qualifications to do that with. Okay. Now, all of the qualifications you get, whether you get the certificate, the extended certificate, the diploma, any of the qualifications, you get a good knowledge and understanding of health and social care. This course has a lot of the modern ideas in the health and social care industry. It looks very much at, for example, at the development of relationships, very much about safeguarding. It is a really modern, up-to-date course which will prepare you for all sorts of different things. We do quite a few practical activities. There's quite a lot of coursework in this course, as well as examinations. You will get university points that allow you to access a variety of courses, also work experience and volunteering opportunities. This course is also good for people who might want to go straight into employment, and I do get quite a few students who do that. We also have a really good relationship with the local hospital, North Tees Hospital, and they've been coming in and doing training with us, and I know that we're going to look at setting that back up again in September, despite the current crisis. Okay. So Unit 1, very briefly, everybody does Unit 1. You're going to have to do Unit 1, whichever course you choose, and it's about relationships. And that's a very modern theme in health and social care at the minute. In the health sector, in the social care sector, it's about the kind of relationships you have, the way to develop good and positive relationships so that the patient, the service user is at the centre of everything that you actually do. So you look at a variety of methods of communication, for example, British Sign Language, those sorts of things. Okay, Unit 2, this is the one we're going to start with in September. This is externally assessed, and at the moment the plan is for you to take the examination in January of next year. And this looks at equality, respecting diversity and rights in health. Now, this has been quite a current topic area through the coronavirus situation at the moment. And a lot of students will be interested, I think, in looking and exploring the differences in relationships, the differences in opportunities and care, and how we can overcome those differences to be a more equalitarian society. 3, now this is a very, very current unit, and again, this will be externally assessed in the summer. It means what it is to be safe. All the things that we're doing through coronavirus and COVID-19, all the social distances, all the changing in work, in placements at work and how you deal with that, and the masks and the PPE that you will have heard a lot about. This is what we're looking at. We're looking at how to do a risk assessment. That's a really good practical thing to be able to present to employers, to present to university. So this is a really, really current unit, something we're all thinking about right now. If you're going to do the single A level, this you'll do in the second year, but if you're going to do the double class with me in the first year, this we will be doing as well. And again, there'll be an exam in January 2021, and it's all about anatomy and physiology, our bodies, how they work. We look at each body system. We look at how we breathe and how we eat and how we move. And also we look at the problems that go along with it, the diseases, the disabilities, the impairments that each body can present with us, and ways in which we can adjust the world to support the people that, for example, have asthma or have diabetes or any of the other diseases that we have a look at. And I found that one particularly interesting, to look at the different diseases, disabilities. It's another favourite part for me. Now this one, again, is on sexual health, reproduction and early developmental stages. Everybody's going to do this one, but it's particularly useful if you're looking at teaching, if you're looking at being an adult nurse or paediatric nurse, all sorts of different things. It's really useful, this particular one. And again, if you're doing the single health and social care class with me, you do this in your year 13. If you're doing the double, you'll do it in your year 12. So we look about the legislation, we look about sexual health, STIs, we look about conception, pregnancy, what happens in the process of birth, how to support people after they've given birth, particularly things like looking at depression, antenatal depression, those sorts of things, how you care for a newborn, and the development up to the age of 1. Okay, so that people find this really interesting and a good activity to do. And again, you can do practical activities, courseworks on this as well. The final one, nutrition. I'm very excited about this one. This is an area that we really all need to be thinking about. How does eating affect our health? Okay, what are we going to do about the rising levels of obesity? And I have a confession here. While I've been at home working, I'm afraid I have put the pounds on. So maybe we could be looking about how to get the pounds off me and how to make me healthier. I could be your case study that you could use next year. Okay, so we'll look at the diet of an individual. Now, there are other units that would happen in year 13 if you're doing the double: safeguarding, long-term physiological conditions, infection control, very current, personalisation, which is a really, really important topic in the health service, a really important topic in social care. The government, all the agencies are talking about how you personalise, how you have a person-centred approach. This would make you very, very employable, or be very, very useful when you go on to a nurse training, midwifery training, police, all of those sorts of things. And again, promoting health and well-being, that's really useful as well. And I know people are very keen on this one, supporting people with mental health conditions. So we've got a whole unit on that one coming up in the next 2 years. That's another area that excites me a lot. How you're assessed. You'll have noticed already there's been a couple of things I've already mentioned. You're going to get a mixture of exams and coursework. Every unit, you'll either have an exam in it, and I'm sure exams at the moment are kind of scary ideas for you because you've not even had time to practice those because of not taking your GCSEs. But we'll look at exams and coursework, and each unit we will build up the qualification. So unlike an A-level or an AS, we take the exam at the end of the unit, we get the result, we can resit it if we wish to, but once that exam is done, it's done. We don't have to go back to it, and we build up all of the points from each unit and we get a grade. So at the end of the 2 years, you'll get either a distinction star, which is the same as an A star, or a distinction the same as an A, or a merit, which is the same as a C, or a pass, which is the same as an E. And again, it will depend on what grade you get in all the different things. So I will explain that to you in more detail as we go through the course. But it is a nicer way to sort of get chunks of qualification and build them all up, rather than having to worry about the exams at the end of 2 years. Okay, now work experience and volunteering opportunities. These are really important part. There's not compulsory part of the course. You do not have to do work experience. You do not have to do volunteering. But for a lot of your future plans, your progression, universities, employers will want to see that you've done something. So again, North Tees Hospital is going to be working with us to help provide you with work experience opportunities. Obviously, I need to find out more details of that given the coronavirus epidemic. But Revitalise is an organisation we work with, and you can go and work with adults with disabilities on holiday for a week. And we do that every year. We've been doing it the last 14 or 15 years. I've done it myself a couple of times. It was really exciting. I really enjoyed it. I was tired, but it was brilliant. We're also going to be we can also help you find local work experiences as well, to use your own contacts or find some new contacts for you. For example, if you want to be a primary school teacher, as lots of my students do, you'll need to work in a local primary school as much as is possible. And we can help you find that as well. Okay. Now, equipment. There are 2 textbooks that are available. The first one is the main textbook. It's provided by the examination board. We will provide you with an electronic copy of that textbook, which you will not have to pay for, but you will have access to it on your phone, on your tablets, or on your laptop. So that's very easy. You will also get a handbook, which has been created by me with lots of things in it, like past exam papers, the syllabus areas, activities for learning, mark schemes, coursework instructions, all those sorts of things. There is now this year, and I'm really pleased about this, a revision textbook that you can purchase if you wish. Now, we don't provide it for you, but it's a very reasonable price. And again, you can get that as a physical copy, or you can get it as an electronic copy. I bought one a few months ago from Amazon, and you can get it from any other retailer you like as well. Our external moderator, who visits me twice every year, has basically said our resources and our assignments are fantastic. So we've got good quality resources, lots of IT rooms, lots of booklets, lots of teaching rooms, and we've got really good resources. So that's a positive for us. Okay. Oh, I have lots of students. Okay, and I really missed my students this year, so hopefully we'll get to know each other very well, and I won't have to miss you. As you can see from the whiteboard, lots of students have done lots of different things. For example, Ava at the top at Northumbria, she went on to do mental health nursing. Lots and lots of my students go into mental health nursing. I've got quite a few this year who are waiting for their results in August to see if they can go on to mental health nursing. Jude, he went to primary education at Sunderland University. I know he was very excited about that. We've also had other people. Evie went to Durham University to do primary education. We've got Alicia, for example, on there, does early childhood studies. A lot of the students that work with me go into early childhood studies courses at Teesside. As you can see, Tony went into psychology and counselling, and I know I spoke to her the other day, and she's really excited and really enjoying that. So that's the way that she wants to go. Caitlin went to Liverpool University, and she's doing criminology. So not everybody who takes health and social care goes on to a course that's directly related to this. You can go on to all sorts of things. And as you can see, Emma went to York University, and she's doing English literature. But I know that she enjoyed her health and social care as well. So there are lots and lots of different things that people do with this. Most of my students will go on to something health and social care related, but there are quite a few students who don't. And finally, Sunila, you can see they went to Sunderland University. She worked really hard. I was very excited that she went on to pharmacy. So there is quite a variety of things. I mean, Sunila took chemistry along with health and social care, and she's been very successful. So, you know, health and social care opens lots of doors for lots and lots of different qualifications and lots of different futures for you as well. Okay, so if you have any questions, I'm sure that you will put them on to Liv and Patrick. So if I can answer your questions, I will do. Liv, back to you.
Yeah, it looks like we don't have any questions.
Fair enough.
So I think we're absolutely fine, Jenny.